When you're first diagnosed with metastatic breast cancer, there are a lot of different options for your treatment. It could be that hormone treatment is right for you, it could be that chemotherapy is right for you, and it could be that radiotherapy is right for you.
I take tamoxifen, which is quite common drug used with cancer. Tamoxifen reduces the oestrogen in your body and it's a cancer-fighting drug.
The majority of breast cancers will be hormone sensitive. For women who haven't gone through the menopause, tamoxifen is a drug that is often used because that blocks oestrogen wherever it is coming from. It doesn't matter whether that's being produced from the ovaries or whether it's coming from outside of the ovaries.
We can treat that cancer by starving it of oestrogen, and we do that with hormone treatment.
My cancer likes oestrogen. That's its fuel. So let's stop all the oestrogen. When you get given these drugs, there's about 2 to 3 A4 pages of these side effects, symptoms and side effects. You know, and it will start with all the sort of common ones, and then in severe cases you might get this, and it's like, I wished I hadn't read them because I looked at all these awful side effects. Like, well, you can get hair loss, my immune system can be affected, you constipation, diarrhea, getting fat, getting thin, it's just endless. And so when I was finally given these tablets, I didn't take them for a couple of days. I just thought, I'll give myself a couple of days of just being me, normal, no drugs anymore. Start taking the tablets, nothing happens.
The cancer cells have established themselves and treatment is no longer curative, but we know that we can control breast cancer like this for a significant amount of time using just hormone treatments alone. And we try to continue using those for as long as we can and delay the time before we need to use any chemotherapy.
When we take a biopsy, we look to see whether or not it's breast cancer, but we also look to see if there are receptors on that breast cancer. And the receptors that we look for are mainly the estrogen receptor and the HER2 receptor. If there is no estrogen receptor, hormone treatment won't make any difference. If there is a HER2 receptor on the breast cancer cell, it means that we can treat the cancer by using Herceptin. And if there is no HER2 receptor, then we don't treat with Herceptin because it would not be effective.
I was diagnosed with primary breast cancer 11 years ago, and basically it's come back and it's spread to my liver. But it's the same breast cancer, it's still HER2 positive, which means that one of the drugs that I had initially, Herceptin, they're using it again to treat me because it worked so well the first time and kept the cancer at bay for 10 years plus. I have a combination of 2 drugs which both treat HER2 positive metastatic breast cancer. So as I'm estrogen receptive, they prevent the estrogen from feeding the cancer cells.
And you would also have that with chemotherapy because those drugs are only given with chemotherapy.
You have the hormone therapy and the chemotherapy treatment, and it was all done on the same day. And since the chemotherapy is finished, the other 2 drugs were administered 3 weekly, and that has continued and will continue for the rest of my life. I don't have any side effects at all. I'm living really well and coping with the 2 drugs that I'm on with no problems whatsoever.
A minority of breast cancers will not have estrogen receptors or progesterone receptors on the outside of the cancer cell. These types of cancers will not have any benefit from hormone treatments. So blocking estrogen or blocking the effects of estrogen will not slow that cancer cell from dividing. Those breast cancers, therefore, often we would consider chemotherapy either to reduce the chances of the cancer coming back or to slow its progression and to produce a response.
There's just so much research and innovation going on, and there are new drugs coming out all the time that are having an amazing impact.
The breast cancer is likely to be controlled for a period of time before the cancer cells become clever and work out a way to divide and grow despite the damage that's being caused by the treatment we've just used. We then try a different treatment to get round that resistance. It tends to be, however, with each treatment that we use, that the benefit, the response, the duration of response tends to be slightly less. That isn't the same always, but is often the case. Then we focus on treating symptoms and actually sometimes managing symptoms using other methods other than chemotherapy or hormone treatments can be just as effective.
I'm never out of pain, but it's manageable, and it's that fine line between having your pain relief so that you're out of pain, but you're drowsy and tired, and I prefer to suffer a bit of pain so that I can still go out and enjoy myself or go and meet friends and go to appointments.
There are a number of different things that we can use that may not slow progression, they may not improve prognosis, but can improve quality of life through improving symptoms.